Hi, doctor. I was thinking today, having learned to provide orthodontic treatment for my patients is the single reason that I've stayed in dentistry. I love it. It's absolutely incredible. Had it not been for learning orthodontics and being able to provide that for my patients, my specialty of pediatric dentistry is one from which I would have run. Seriously, let me tell you why. Our beloved specialty of pediatric dentistry was begun by Dr. Samuel D. Harris. And believe it or not, that was in 1927 when he began his Detroit pediatric, or pedodontic, he called it, study club. And which is amazing, as the father of pediatric dentistry, as he's known, he was the beginning, or his work was the inception of the then 20 years later AAP, American Academy of Pedodontics, which is now known as the AAPD, the American Association of Pediatric Dentistry. These beginnings were wonderful because suddenly it looked at the child patient as a patient who needed something different than the adult patient. And we'll kind of talk about that in a moment, about the child being different from an adult in so many ways, as you well know. But I want to tell you first, in case you don't know, that our beloved specialty of pediatric dentistry has been usurped by big corporations. I include insurance companies and I include government corporations. It's unbelievable what has happened to our specialty and to the way that we approach and treat children. Now, granted, if we do the engineering required to restore decay, that's a helpful thing for a child to a point. But I want to point out to you that we're missing something huge there, and that is the child being able to understand, the parent being able to understand prevention, to be able to understand the source of the decay, and to be able to understand what they can do to have a great oral health future. And they don't get that when we take them to the OR. In fact, studies have shown that when we take them to the operating room or when we sedate them, the parent naturally just believes, okay, you fixed it. They don't understand, and they won't understand, that it's an ongoing process. Now, that's hard in our society, in our culture. We want a pill, we want to fix everything with one quick take the pill and be done. But we aren't allowing the realities of what's going on for the parent and, of course, ultimately the child. Will they have a good relationship with dentistry in the future? Will they have a good understanding of how to take care of their own oral health? Oh, you teach them. They have recalls. Guess what, doctor? It don't cut it. It's not going to impress on the parent and ultimately the child the way it is if they are awake with you and looking and watching you take care of things right there on site. I just want to mention that. I want you to think about that because so many of us are involved in our specialty with the sedated patient. And this is one area that I think is a travesty for our pediatric dental specialty because of what I just said. So as you think about that, let's go back to the fact that the child is not a mini adult. No, the child's organism is extremely different from that of an adult. First of all, it's in constant total flux, right? Changing all the time. And the reality of that is that if we don't gear our treatments to the fact that there will be change, that flux occurs, that flux is, by the way, what we call it growth and development. If we don't gear our treatment to encompass that reality and that eventuality, then we have not treated the child properly. In other words, you don't just restore a cavity. What you do is you ponder how this tooth will be used, when it needs to be gone, is it in the way of an ectopic tooth, permanent tooth, so many things. So the point is that flux can only be addressed with an awareness of growth and development and the differences in the child's organism, the human organism. That's their body. Another thing I might point out about the idea of treating a patient in a sedated situation is that while that earns money for the third-party carrier, maybe you can work faster. By the way, you're earning your living, and when you share it with the third-party carrier, you don't need to work faster. You just need to get them out of the picture, and that's another story for another day. But when you are treating the child in that way, you have lost the opportunity to deal with hallmarks of preciousness in pediatric dentistry, and that is the child patient's awareness as well as the parent's awareness. And I can't say loudly or strongly enough how important it is for the parent to have an understanding of what you're doing, what's going on, what their child's needs are, and why. They'll learn about themselves too. They'll learn about their parenting. So that's all a good thing. But back to these hallmarks and geniuses of pediatric dentistry. Look, I'm going to tell you something. There's also another part of it that's huge, and that is the saving grace of orthodontics, the treatment of that child's smile and occlusion in your practice. You're the doctor that knows the child the best. You're the doctor that knows the parent the best. You're the doctor that sees that child and parent every 6 months on a regular basis, most likely, and understands what's going on, what the changes are, and what the needs are. And all of a sudden, what steps in? The incredible grace and beauty of orthodontics. Orthodontics is a beauty treatment, right? And that's something that you can provide that's incredibly important to the child and to the parent. And it will make dentistry as well as the child's smile first and foremost in that parent's eyes. And that'll be right. That's important. You're a physician of the oral health of the child, but you're also a teacher and psychologist to both the child and the parent. So these are some of the things that make pediatric dentistry with concomitant orthodontic care so crazy wonderful. That's all there is to it. So now let's take a look at the fact that you might say to me, oh, there are orthodontic specialists. Well, of course there are. There are endodontic specialists. There are specialties of perio and oral surgery and prosthodontics, so many wonderful specialties. But you, as a general dentist, a GP, or as a pediatric dentist, a generalist for that child, choose which specialties are appropriate for you to offer to the child patient. You see? Because they're all specialties, but you as the generalist can offer whichever and whatever treatments are appropriate and best for the child that you feel are going to be what you're capable of, what you're working with, and what that child needs. So don't forget that. The saving grace of all of this is that the child is best treated by you whenever possible because you get to know them and you get to know the parent. So those are important points as you choose the specialty of orthodontics for that child as well. And as I provide orthodontic treatment every day that I'm with my patients, I thank God for the opportunity for my life transformation, not to mention that of the patient and parent. It's an incredible thing, this orthodontics. Now, having given you a little talk about providing orthodontics to pediatric patients, what I want to say is that one of the areas that is problematic for a lot of people doing orthodontics, including people who limit their practice to orthodontics, is the finishing and detailing of cases. Because there are reasons, and because that's so hard, sometimes that presents more difficulties than anything, and dentists get kind of put off by that fact. So we now have in our finishing course online a course in finishing and detailing, which is going to talk to you about those difficulties. But I want to start out by telling you, why is it difficult? Why are there so many finishing courses out there? And that really is what I want to tell you about now that you understand that as a dentist for children, GP or pedo, you can absolutely do this in a way that's going to be great for the child. So now we come to finishing. Why is it tough? Why is it challenging? I'll tell you. Let's start with some different awarenesses that will help you understand it. The first awareness I want to give you is that again, as I mentioned, the organism that we call the human body is not reliably predictable. We can't determine how it's going to react to so many things. It is so amazingly variable. For example, think about two maxillary central incisors. Their labial surfaces can be totally different. One can be flat, like a tabletop practically, and one can be rounded, high profile, almost like a canine. This is a problem because when you go to try to line those up with brackets sitting on them, that can be problematic. Even, by the way, I noticed the other day an article that was talking about how with aligners, that can even be a problem because the more rounded a tooth is, the more difficult it is to give it the rotational and torque perspective that you need in the arch. So the variation in tooth anatomy is huge. And the variation even in two contralateral teeth, let's say two lateral incisors, or two lower incisors, or two canines, or two bicuspids on side to side, right and left. They can be variable, very much so, both morphologically, and they can even react differently to what seems to be the same force, the same work that you're doing, the same providing treatment that you're doing. It's interesting how differently the body can react. So then, not only right and left, the body can react differently from time to time. You may do the same exact thing as far as you can tell, the same forces, the same appliance, the same way of approaching something in that child, and 3 months later, guess what? All of a sudden, the reaction's different. The human body's different. They're growing, they're changing, and even in a non-grower, this happens. The variability of the human body, that's one awareness, okay? Now let me tell you another awareness that you need to have, and that is the awareness that our systems, our orthodontic appliance systems, are far from what you think they will do. They cannot do what you expect a lot of the time. They cannot do what they're set out to be used for. They can get you close. Often they don't get you there. I have to tell you that Larry Andrews in the 1970s said when the wire stops working in straight wire orthodontics, you know you're there. What a wonderful situation that would be. Not true. Why? Because of the variability of the human organism and because of the variability in the appliance systems. I will tell you that even the slot size sometimes can be off, very different from one bracket to another bracket from the same company with the same named size. The wires can be different. You would think, how can this be if it's a metal injected molded bracket? They are, trust me. So the appliance systems are far from being able to provide exactly what you're after for your patient. Sometimes, gloriously, it works, and often it don't, as they say, okay? So that's another awareness. And how about the human mind body, because they are connected? How about the fact that the patient's mind, let's talk about compliance. Sometimes that patient's willing to be super compliant. They're on a roll. They're going to do what you ask them to do. They're going to take care of plaque control, or their parents are. They're going to take care of wearing the elastics. They're going to just be real good about it. And sometime later, they aren't. Why? Because we're human organisms with a mind that is busy with many things. And a child in particular is busy with things that we adults sometimes can't even remember, can't even imagine. The mind-body together is variable, unpredictable, and doesn't do what we want it to do. Then you have another factor. This is a huge awareness. The errors in assuming these things to be different than what they are what drive us crazy. Let's talk about the doctor. Let's talk about you. Let's talk about me. I sometimes have days in orthodontics when I see patients. Let's say I see just a few, just 10 or 12 patients, which is not a lot for orthodontics, a day of ortho. And everything's going well. I go away from that morning, let's say, thinking, oh, this is pretty good. I love orthodontics. And I do. And then that afternoon, I start seeing a few more patients, and 2 or 3 of them, things aren't going the way I thought they would. Sometimes I can see the error of my ways and say, I need to do this or that, change this wire, change this bracket position. Sometimes I know I'm not getting compliance. The reality is my humanness is also limited. Oh, would that we could be perfect. We dentists always wish for that. We dentists are perfectionists, which of course you can never reach. And so that comes into it too. Can we put the brackets on perfectly? No, no one can. Some studies years ago with some fantastic clinicians who were used to bracketing and felt they knew exactly what to do, and so did everyone else, found many degrees of variation in where the bracket was and where they wanted it to be. Variation in torque of up to 69 degrees on a lower incisor. And that's in your finishing course if you want more details. 69 degrees, think of it. 90 degrees is a right angle. 69 is close. That's a lot of variation from where you want it to be. So my point is our humanness comes into it. Can you get that occlusion perfectly, beautifully each time you're working with a patient and finish that ortho case? Can you do that? Maybe when monkeys fly, you can't often. Why? Because now we're back to the patient variability. You know how many bites they have? Do you know how many different patterns of occlusion they have? Do you know how much the human brain can quickly alter the pattern or the positioning of what you might think is supposed to be reproducible CR or reproducible position very quickly once there's a slight occlusal interference? So now you as a human and the patient as a human organism can't get the bite right. Okay, you understand some of these erroneous assumptions that go into what's going on in your orthodontic treatment? So now you know. Now you know there's a lot to know. Now you know there's a lot to overcome. And don't let anybody tell you that they always get it right, because that just isn't true. Understand it's impossible, and yet orthodontics changes lives, yours and theirs, for the better. It is indeed something that the patients want more than anything. Don't quit orthodontics. Don't quit what they want more than anything. Don't quit orthodontics because they need the most beautiful smile, because beauty, the studies have shown over and over and over, provides the possibility for more intelligence, more social ability, more success in life. Why do you think all these people are out there getting veneers and cosmetics and everything to make their smile better? You know. And orthodontics, we think what we call orthodontics, which is really a full mouth reconstruction, is going to fix the bite. Good luck with that. But don't quit. Don't give up on it. They want it more than anything. You want them to have their beauty. You want them to have the best occlusion that you can provide. And you also, yes, you have to learn when it's time to quit and cut bait. There are times. That's all we can do. Sometimes it's because of the orthodontic appliance limitations. Sometimes it's because of the patient's mind-body limitations. Sometimes it's because of limitations we can't even enumerate. But I don't want to make you feel scared about it. I just want you to understand, don't quit. The most successful doctors, the most successful people are those who go after with a vengeance, constant and never-ending improvement, who keep learning, who keep growing. And that's you in dentistry. Make it true in every part of what you're doing, because only then can you get to that goal. Getting to the goal doesn't just require keeping on. It requires, as I mentioned, the learning, the growing. But also, I do want to tell you that the course is full of biomechanics information. It's full of ideas and understandings. Not only is it showing the limitations so you get an idea and better form of them, but it's showing you what you can do to both prevent and also to treat and to work with some of these issues. And it also is giving you ideas about accessory appliances and about how you can utilize various treatments within the orthodontic spectrum to not only, well, to prevent, and not only that, but to overcome some of the problems that you otherwise might have. It shows you how to start from the very beginning. It shows you how to sequence, perhaps sequencing with sagittal first, getting your AP correction to a class 1 should come, in most cases, the very first, We used to think otherwise, but now we know that that's going to be helpful. You'll learn about that. You'll learn about how to use accessory appliances. You'll learn about how a mini bionator can change everything for a patient on whom otherwise you have a hard time getting the overbite and overjet what you need it to be. So there is a lot in the course for you. There's even a good amount on communication, because remember, talking and relating to the parent and patient is everything. They want it, you want it, they're going to love you for it. They're never going to think you don't care when you talk to them and give them information in the way that you can. And that's in the course as well. So these are all things that you can pick up in this wonderful course on finishing and detailing. And when you go away from it, you'll have a whole new perspective, a whole new set of understandings, and a whole new way to approach what you're doing. Don't quit. Don't give up, because otherwise you'll miss out on the most precious, the most incredible, loving, and relationship building that you can have. Absolutely incredible. The bottom line is you can shorten your treatment time and improve your finished results. It's all in the course. You can do it, and you can be transformed yourself and transform those patients. So that's what the course is about. Please visit us at drchrisbaker.com and look at the course, look at the courses there. If you haven't started orthodontic treatments yet, oh my gosh, there's so much for you on that site. If you have, there's so much for you on that site. I'm loving putting it together. I think you're going to absolutely love the information that it gives you. So doctor, don't hesitate to contact. We love you. We're there for you. We're happy to help. Call on us and enjoy the course. Thank you so much, and I will hopefully talk to you soon.